In an effort to fight vaccine misinformation and, of course, reluctancy, President Joe Biden has endorsed a door-to-door campaign.
But do door-to-door efforts actually work? Union County, New Jersey, giving it a try. So we went along one day last week to see how this actually all works. Take a look.
I'm here with the Union County COVID-19 outreach team.
Union County is trying to reach every unvaccinated resident it can. It's contracted with an outside company to send trained canvassers door to door. They knock, move away, and see if anyone answers. They provide information about all kinds of county services.
Our goal is to get 70% for each town. We really target the towns that are at the lowest rates right now.
Here in Plainfield, the vaccination rate is under 60%. John Williams got vaccinated early, and he's all for this effort.
It's a good thing. I really think it's a good thing.
The canvassers generally are from the area, have a sense of it, know the ethnic languages, and may not be the only unexpected visitors. Canvassers say most unvaccinated are not simply opposed to the vaccine. They're more often under mistaken assumptions that the vaccine costs money, or worried about side effects, or they have transportation issues and simply can't take off.
Thank you. No problem. Take care.
That's why the county has people sign up for a vaccination and sends a mobile vaccination unit. The day after this effort, it came to a nearby park. Union County says 3 people signed up by the canvassers got a Johnson & Johnson shot. That sounds like very few, but it's 3 more towards the goal.
The goal is just to get as many people vaccinated as we can to move past the pandemic.
Okay, so it sounds very interesting, right? Another reason some people are not getting vaccinated is because they're undocumented and afraid of actually getting caught.
But how effective is going door to door? That is the question. Here to help us understand is sociology professor Elizabeth Wrigley-Field of the University of Minnesota. Professor, thank you so much for being with us.
Glad to be here.
So as we saw in that package, sometimes door-to-door on-the-ground outreach is really the most effective. You're involved in a group now going door-to-door in the Somali community there in Minneapolis. How is that working so far?
That's right. I'm part of a small neighborhood group called the Seward Vaccine Equity Project. And so the core of our outreach, and I want to be clear that I'm not the one who does this because I don't speak Somali. So this is led by a Somali pharmacy owner in our neighborhood and other Somali members of our neighborhood. The core of our outreach has been 2 things. We go door to door in the local Section 8 housing, and we do outreach through the local Somali mosque. And the reason why this is so important is that it gives you a chance to actually have a conversation and answer what people's real concerns are.
So let me ask you this, Professor, then, because you're bringing up those concerns, what actually are you hearing are the concerns of people as to why they have not gotten vaccinated just yet?
So it's shifted a little bit over time. The number one question that our outreach community members get asked first is, who's paying you to do this? And we're an all-volunteer organization, so they can say, no one. And they explain why they're doing it and why they got the vaccine and why their kids have been vaccinated if they're over 12 and why they think that it's important. What shifted is that there's a particular concern about children. So our focus right now is about vaccinating the 12 plus population before school starts.
Right.
And we found that a lot of people who were glad to be vaccinated themselves are more worried about having a drug that's not fully authorized, that hasn't been around very long, a medical product going to their children. And some context that's relevant for us is that our neighborhood and the Somali community in our neighborhood in particular was specifically targeted about 3 years ago by Andrew Wakefield, who's the discredited former researcher who originated the idea that vaccines cause autism. So he came out here and did events with the Somali community. And the result of that was that childhood vaccinations plummeted, and we had a big measles outbreak a few years back. And that context kind of hangs over these fears about what will I be doing to my child. So there's a lot of questions about autism that come up as well.
Yeah.
Right. And now we see a lot of people who are latecomers, right, to the vaccination club. Their fear of this new highly contagious, strong Delta variant outweighs their fear of the vaccine. Do you think that is now a motivating factor in getting more people vaccinated?
I do think it's a factor. Our experience has been that the people we talked to were never dismissive of COVID. So it's not that they didn't think that it was a big deal. They're very worried for their parents, in particular for the older generation. Many of the people who we're talking to live in multi-generational housing. And so this is a real concern. And so the people who are trying not to have their kids be vaccinated are also often then trying to keep children and grandparents apart, and that's a big cost.
We are almost out of time here, but I want to get your thoughts on this, because as we saw in Union County, New Jersey, in that piece, a full day of canvassing only resulted in 3 people actually going to get a vaccine. Is this an efficient way? Is there a better way?
I don't think there's a better, I mean, I think we need multiple ways. We have to go to workplaces, we have to go through unions and workers centers and community organizations, but I don't think efficiency is the goal. You have to come back over and over and over again. People respond to what their friends do. So the first time, maybe they don't know it. People who've done it, they think it's a bad idea. When you come back again, they know that their neighbor did it last time and is fine, and that actually changes things over time. So I think this is exactly the right approach at this stage.
Those are still 3 people that are now vaccinated that possibly would not have been. So.
Every bit helps, right? Professor Elizabeth Wrigley-Field, thank you so much for what you're doing and coming on to explain a little bit more about the program.